I am Dr. Mayank Saxena. I am Additional Director in Department of Pulmonary Medicine at Fortis Hospital, Noida. Genomics, as per se, perceptive to any infectious disease, carries a very important role. First of all, genomics is identification of genes or whole genomic structure, the whole DNA analysis of the bacteria, basically. So, if we say about the tuberculosis, it has a very good impact in first of all diagnosis, and then about telling about the drug resistant status of the tuberculosis. If we say genome sequences, though it is still to achieve, it is still very expensive test to be done, and it is done in very limited laboratories. In India also, we say very few laboratories that are doing the genetic test. So there's few limitation, cost and logistics. However, if done, it can give very vital information about the diagnosis of tuberculosis, the pattern of tuberculosis, the resistance pattern of tuberculosis that is prevalent in specific areas, like if we say North Indian area, South Indian area, or East India or a West Indian area. So if there any specific pattern with regard to resistance is there, or any about the drug responses, what we can expect better out of that. So WGS, we call this whole genome sequences, has got a very vital role, but still it has to be adopted by the Indian guidelines. Government guidelines has still to adopt it, and the pricing and logistics are the few limitations that we face. If we see tuberculosis ethical considerations in research, there are three main areas. If I say, first of all, it is in the diagnosis. Second thing, in the treatment part, and third is a lifestyle and about the how it is going and follow up and all everything. So if we say the diagnosis part, the some limitations that we see ethical consideration are important is like if we devise any new test, like for the research purposes, some new test is there, we have to be very sure about it if it is not giving any false positive result. Second thing, if we cannot start a TB patient on a TB, we cannot start a patient on TB treatment based on just a newly diagnosed test that can be even false positive, because in India TB is present in the community. So we have to be very alert about it if we are introducing any diagnostic test, basically how specific and how sensitive it is in diagnosing the disease. And we have to make it in parallel, like we have to get the old test, conventional test, and compare it with the new test. If the results finding are same, then only we can consider for a tuberculosis treatment. Now the treatment part, the one ethical consideration that I would rather say is we cannot if any new drug is introduced, if any tuberculosis positive patient is there, we cannot give a different treatment to a different patient when a TB is considered. So the treatment is very standardized for a tuberculosis, whether it is drug sensitive or drug resistant. There are particular set guidelines that we have to start these 4 medications for the category 1 treatment. So we cannot deviate on a patient to patient basis. Let's see, we have to research and we can add on the treatment. So particularly for any new medicine, it is done specifically on those patients who are having XDR or MDR category of treatment. And third is lifestyle. Ethically, if we see, there's still social stigma that is involved with tuberculosis, and also the patient cough etiquettes and everything needs to be considered. Now coming on to the particularly about the health, the vulnerable group, there are 3-4 kind of vulnerable group. If we see the people living in a close contact with the tuberculosis population that are like close relative. Second aspect comes with those patients who are having immunocompromised status, particularly with like HIV positive. And third thing, the healthcare workers, the hospital workers who are being exposed to the tuberculosis patient more often. They are like more particularly we say in doctors and nursing group, the ophthalmologists, the dentists, they are like quite, and pulmonologists, they are very much exposed to tuberculosis patients sometimes, and also the close contact would be there with the dentist and ophthalmologist, and also the nursing staff. So in these scenario, one thing that would say that repeat the diagnosis and everything, we have to be like monitor like routinely, like we used to do COVID test every and there and then. So as of now, it is not recommended, and ethically it is also not feasible to burden the labs. But yes, these are the things that we can consider about these particular specific vulnerable groups. In fact, I have encountered this several times. I will enumerate you several of few scenarios. I had a patient like who was getting married in next 1 or 2 months. She was diagnosed with tuberculosis. We started on treatment, and we counseled for the proper treatment. We even got it registered through the government programs. But after marriage, due to fear about the social stigma and taboo, patient didn't disclose about a tuberculosis diagnosis in her in-laws, and ultimately we see more with the females that are getting married and undergoing any treatment, as these treatments are a little more susceptible to be discontinued, or even they may face a little social stigma. Sometimes their marriages are broken. So for that particular if we say that the females who are getting married, they are the particular let's say important issues that needs to be addressed, and social stigma needs to be cleared. Now, the second case scenario, I would also enumerate the students, the student community per se, those especially who are studying abroad. And sometimes they fear, like if they are coming for a screening and tuberculosis is diagnosed, we are starting on the treatment, and practically we cannot still till the time the tuberculosis is managed, we cannot send them to their respective foreign countries also, because they may have a spreading potential. So ultimately they may either spread away, or they may not continue the treatment, not report to the even their hostels and hospitals or hostels, or their colleges where they are working or they are studying abroad, or as well as in India. And then it is a problem. So this student community is also a little susceptible, or even the people working in the close environment. Now, there's some social stigma also that we see in every component of society. Sometimes patient may deviate from the treatment. Let's try some other pathy or some other thing. And there's sometimes patient are not very keen for a treatment because of the side effects and all. So there also we face a lot of difficulties. We have to counsel them that you have to continue the treatment accordingly as per the guidelines. My message for TB patient is TB is a easy disease as well as difficult disease. If you are managing it in a right way, it's just a 6 to 8 months of treatment that is required, and it is just it is fully treatable. It is not like it will not trouble you much. If your TB treatment is perfect and you've been consulting, you've been following up with your doctors completely. But it can be a very difficult situation if you are not following it properly, like not taking medications regularly, you have stopped in between, then it is bound to get into drug-resistant TB, and that is a trouble where the TB situations may complicate. It can be even life-threatening also. So don't risk stopping or altering the treatment. Just continue with the treatment. Trust your doctor. Follow them. TB treatment is not an easy treatment, but yes, it is very effective treatment.